Hi, I'm Brent Oliver, System Vice President for Care Experience at Dartmouth Health. I'm here with Don Welshman, who's the Interpreter Program ADA and 504 Coordinator at Cheshire Medical Center. Hi, Don, and welcome. Thanks for joining. I wanted to talk a little more about the role of communication and why it's so important for care experience. Can you share a little bit about what effective communication is in a healthcare encounter?
Absolutely. Hi, Brent. Thank you very much for taking the time to speak with me today. Effective communication in the healthcare encounter really is the ability for someone to be able to have a conversation with another person in a way that's engaging, in a way that is focused and consistent, um, and clear. And when I think about effective communication specific to a healthcare encounter, I really think about it being a two-way street. And the ability for individuals to be able to converse back and forth. It's not a one-way street. When it happens in that way, it's a conversation which adds value to the encounter.
What are some of the ways at Cheshire Medical Center in which you ensure effective communication to enhance the care experience?
Sure, we have several different ways. When we think about the overall healthcare experience, we do it in many ways. And if I could just take a step back to think about why is it that effective communication is important in the care experience? And when I think about effective communication, I think about the ability to be able to build relationships, having the opportunity to really sit and listen and effectively communicate allows individuals to understand the goals and the expectations of each in that encounter. Having the ability to do that builds trust, it builds empathy, it builds understanding, and in essence, as I mentioned, builds a relationship. And when we have that, we know that it increases the satisfaction of the employees who are engaged in that encounter, as well as our patients and their families and those who are communicating in that encounter. In addition to that, it really allows the individuals to partner in their healthcare to ensure that the goals and the expectations are being met by all, that they're on the same page, which in turn really allows individuals to adhere to medical advice and treatment plans. It decreases healthcare utilization, and as I mentioned, increases the satisfaction in the care experience for all. So when I think about how do we do this at Cheshire Medical Center, we do it in many different ways, and we do it for different individuals. So one of the key things that I think about for our employees in regards to effective communication is our safety huddles. So Monday through Friday, every morning, our organization engages in a safety huddle. It's no more than 30 minutes. It's really key information that is passed specific to patient experience. And I should say effective communication increases the safety of our patients, as well as the care that that uh, our personnel is providing. And so the goal of the safety huddle is to really look at, are there any safety concerns? It's a quick conversation to ensure that our patients are safe, that our staff have what they need each and every day to be successful in providing that care experience. The other way that I think about effective communication here at Cheshire Medical Center is in our rounding. So we have leaders who round at least on a monthly basis, but really organically it happens more often than that with their employees being able to round and ensure that things are going well and folks have what they need. As we move it out into the experience of our patients, we round with our patients. We check in with our patients, not only during a specific clinical encounter, but many times throughout their visits with us, checking in to make sure that they have what they need, that they're doing okay, checking in on pain and how things are going. And then, as you mentioned, Brand, I am the Interpreter Program ADA 504 coordinator, so I would be remiss if I didn't include how it is that we go about providing language equity here at Cheshire Medical Center. And we do that in many different ways. In providing language services, we do that by providing interpreter services in many different modes. We do that at no cost to our patients and our and their companions. We also have auxiliary aids and services that are readily available for individuals who come to us who may need a little something to ensure that their communication is effective during their encounters. That too is provided at no cost to them. Um, and I would like to say that when I think about interpreter services or auxiliary aids or anything that might be a reasonable accommodation in regards to effective communication, again, that is for everyone in the care experience. We often come to our care experience and we think the interpreter is only for the person who maybe doesn't speak English or is proficient in English or maybe deaf or hard of hearing. But really, if our patients and their families are experiencing barriers, so are we. So it's for everyone in the care experience. So those are some of the key ways that I think about how we go about ensuring communication is effective across our organization.
Don, thank you very much. This is just a small piece of the large portfolio of work you're engaged in at Cheshire Medical Center. And I think your comments were really on target, and that the care experience is about patients, families, and professionals. And communication is at the heart of quality, safety, equity, and the experience. So thank you very much for sharing just a little bit of what you do every day at Cheshire Medical Center. Thank you for your time and all your efforts to improve the care experience at Cheshire Medical Center and in Dartmouth.
Thank you, Brent. Have a great day.